Well, it is 11:30 on Thursday, June 17th, and my name is Natasha Palmer, and I will help be the moderator for today's Clinical Research Ramp Up Town Hall. And hopefully everybody can see the screen, the slides that are being projected. We have, if you look down on the bottom of your screen on your Zoom settings down next to participants, there's a Q&A. So if there are questions that you have, feel free to type them in that Q&A box, and we will address your questions at the end. We have a few presenters that will be talking this morning. We realize that time is an issue and constraints, and there are some competing meetings that start at noon today. So we're going to go ahead and get this started and get everybody on the same page. So thank you all again for joining this morning. This is our agenda for today. Thank you again. We're going to have a brief intro and welcome from our Vice Chancellor of Research, and then we're going to dive straight into some of the processes that are in place for our clinical research. So Dr. Tom Flagg, our Vice Chancellor of Research, will provide us with a brief welcome. Thank you. Dr. Flagg, you'd like to take it from there?
Very good. Yeah, thank you, Natasha, for all your work and organizing this, and thanks to all of you for joining us. I'm just watching the participant count, so we're up to about 325 right now or so. I think in the waiting room, you probably heard us preparing a little bit. I think that's okay. That's fine. You know, oftentimes we'll end a talk like this with thank yous. I'm actually going to start out with thank yous. I would say in modern times, this has been unprecedented. We've all gone through in the last several months. And so I would say from my point of view, the research community, the whole research community, and specifically work through the clinical research community has been wonderful. You've been engaged, you've been thoughtful, you've helped us think through issues. Several of you have been serving on various working groups and so forth. I just want to acknowledge at the beginning of this, we appreciate your engagement, your help, and your comments. As we go through this phase, the next phase, and whatever comes after that, we'll need to continue to work together in that regard. I also just want to acknowledge the work by Allison Lakin, who's been leading the working group in this area. She's put in many long hours. The rest of the EH&S group, who's been very involved in this, those individual members of the working group as well. So they've put in, I think, a special effort. Clinical research also involves our hospital partners, so we're delighted to have representatives from both Children's Hospital and UC Health here. They have been involved in the planning and the working of this and the coordination of that. So I just want to acknowledge their work. As I noted, I think this is an unplanned, unexpected time, and we're going to have to continue to adapt as new developments occur. Some people are predicting a second wave in the late summer or fall, and we're making preparations for that. But whatever may happen, we appreciate your ongoing engagement. And we're going to respond to those as needed. The guiding principle thus far has been the safety of the research community and our participants and coordination through our hospital partners. Those will continue to be our guiding principles as we move together. We are working to, as quickly and safely as possible, ramp up clinical, laboratory, and community-based research. And by community-based, I mean any research that happens beyond the confines of our campus here. One thing I just want to put out there as we think through this, so we'll spend a lot of time today in the details of where we are right now. And again, that'll be explained. We'll have plenty of time for questions and so forth. The long-term impact of this, though, I just like to put this at the beginning of the conversation, is unclear to us. I think there will be specific changes to research. I think there'll be changes to clinical research. I don't think any of us are clear what those are going to be. It's been clear to me that with certain trials that needed to open very quickly, we were able to open those very quickly, and that was a function of the sponsor, the research teams, and the central research infrastructure, including the IRB and others. I think we all learned things from that, and we should carry those positive learnings forward. COVID officials have been established. This is maybe most prominent in the basic science laboratories, but also in the clinical research areas. And these officials, this local organization is something we've never done before. How do we utilize these individuals going forward and the teams they work with in new ways? We just mentioned the COVID biobank. We have traditionally not had sort of centralized biobanks for emergent events like this. Would typically be each group sort of organizing. In the COVID biobank, we all came together. There's one institutional biobank with thousands of samples, I'll mention now, of which can be requested. And I think there have been over 20 requests for those samples, which we're working to fulfill. But that might be a model for how we could do things going forward. Specific to clinical research, there's remote monitoring, consents, and more. So with that, I'll hand things over to Allison Lakin, who I think will be doing the next section of talk. And thank you for joining us today.
Thank you, Dr. Flagg. We appreciate that introduction and welcome. I'm going to go ahead and turn it over to Dr. Lakin.
Thank you. And I just want to reiterate what Dr. Flagg said, that this has been a real collaboration across the whole campus. So the task force came together. It was faculty from all the campuses, from all research and the affiliates. The Space Committee has been doing a great job too, as well as the Protocol Review Committee. But it's all of us and really thinking through what's safe to do and prioritize what's important for the participants. So thank you to everybody for all the work that you've been doing and keeping research going, because we never stopped. We slowed right down, but we never stopped. And that's thanks to your dedication. So first I want to talk about the space. Next slide, Natasha.
Yep. It's frozen. Just a second. Technical.
There's a number of components to ramping back up, and the university, the Anschutz campus has a number of spaces that are owned, managed, controlled by the campus. And so these are separate from the affiliate spaces. And in the same way as we did with the labs, we have identified a space process, approval process. And part of that is identifying a COVID official, and I'll talk a little bit more about the COVID official in a minute. And then requiring each space to have a space plan so that we're all using best practice again to keep everybody safe. And so those processes are in review right now, and I'll talk about those in a minute. You need the space needs to be approved as well as the individual protocols being approved. Both have to come together. So just because you have a protocol approved, if the space is not yet approved to open, that research in that space can't happen. So we're trying really hard to coordinate these. Next slide. So currently, actually, the number has changed. So this was Friday's numbers. We've got about 22 space plans that have been submitted. We have reviewed of those 16. So most people should have got some level of comment. 6 are currently approved, and they're there. The Barbara Davis Center and the outpatient CTRC are having, we're doing walkthroughs on those spaces shortly. And the reason for the space kind of management is to ensure that we're screening the staff, that we're tracking movement across the campus. We have plans in place for managing traffic and cleaning. So it is about, we have to think about space in a slightly different way than we have been up and pre-COVID. So as Dr. Flagg mentioned as well, these plans are likely to continue to change as we continue to expand use in multifunctional space. The various plans that have been kind of adapted on sometimes in more of a silo will be having to adapt to the capacity of that building. And some spaces they control the whole building, and so that makes it a little bit easier. And others, we're managing clinical care at the same time as we're managing clinical research. So that's those are kind of the challenges. But if you need to, if you have not yet submitted a space form and you control space, the space form URL is on this slide, and these slides will be available after this presentation. Next slide. Key to ramping up research, and this is across the board, is the safety of the staff, employees, faculty, everybody involved. And so it is the same return to campus procedure across the board. So if in preparation, if you could take the Skillsoft training, that is a good first step, and get familiar with the questionnaire. It's an online app. It's easy to do. The expectation is that everybody on campus will be wearing a face mask unless it's designated within their workspace that they don't need to. And everybody on campus that is in Anshute space needs to have a wristband. And all this information is on the Ramp Up website for the university. Next slide. And this is just a continuation of that with the locations for where you can go for screening. And just a reminder on, we really just, some best practices that we've just got to get into the habit of, which hopefully we've always been in the habit of, but you know, we can't wash our hands enough, keeping social distancing, say wearing masks and following the signage. All the spaces should have plenty of signage to help you figure out what is allowed in that space. Thanks. Next. The COVID officials, I think, were a great idea. I'd say they were developed for the basic science, but I think they have a critical role in the ramp up of clinical research. And that is that we can put space plans together, we can figure out how many people should be in a space at any given time. But then we also are approving protocols, and given the nature of calendar visits and frequency of visits, it is hard to predict what approving protocols will do to any given space. So we really are going to be relying on these COVID officials to ensure that we are not too slow in our ramp up, and that we're leaving, that facilities have resources that we are not yet utilizing, but also not moving so quickly that we actually are not complying with our space plan. So I just put a few of the COVID officials for some of the key Anshutes areas on this slide, but the full list of all the COVID officials is on the Ramp Up website. So if you are using a space and you want to make sure that it's going to be feasible for you to complete this study, and if you need to be talking to various COVID officials, then please reach out to them, and they can help set the expectations and help you work through this, because you know, we need people who have eyes on the ground, who can actually see what the scheduling really looks like and what the traffic of participants looks like as we actually implement these plans. Thanks. Next slide. As I mentioned, and we can keep going. Next slide. There is a ramp up approval process. We identified 5 groups of different types of protocols, and right now we are, at least on the Anschutz side, I think it's a little different on children's and UC Health, and I'll let them, each group, talk about where things are at. We're currently ramping up with groups 1 and 2, and that is because we're still working through some of the space challenges that I mentioned. So please, you know, keep abreast of the communications, because that's where you'll see as we continue to ramp up. The approval process has been going remarkably smoothly, I think, unless somebody tells me otherwise. I think we're slightly above 234 now, and that's applications. Some of those are multiple applications, but we've had over 200 protocol applications, and the vast majority, I think we only have a few that have not been reviewed that are in those groups. So please submit applications in through the REDCap link that is on this slide, and keep posted for the next round of groups that will be going. Next slide. I get asked a lot, so this ramp up process is really for research that is happening on campus. And if you're using Anschutz resources, even if the most of the work is happening in one of the hospitals, then you do need to go through the protocol approval process. That is true as well, even if you just need access to, like, for example, AO1 or the Fitzsimmons building. It's so that we can be making sure everybody does the screening. We are not opening those buildings fully at this point in time, so it is limited access into those buildings, space plan approval. The next phase is going to be, there is a research working group that is focused on community-based research, and we're including in community-based research any research that is happening with face-to-face contact that is not happening on campus or at one of the affiliates. So that is also clinical research, as well as research in schools, reservations, gardens, wherever community research frequently happens. So that is the next phase, and I'm hoping that we should have more information on that approval process in the next couple of weeks. And with that, I'm going to turn it over to Erin Sandine to talk through the children's ramp-up process. Thanks.
Thank you, Allison. Appreciate everything that you've done to help us get through all of this. As Allison said, my name is Erin Sandine. I am the Director of Research Operations and Administration at Children's Hospital for the Research Institute, which supports a plethora of the research that's going on at Children's. We have been working through this process and actually initiated our reactivation around May 18th. Natasha, next slide, please. At this point, we have approved over 200 studies, or probably, last time I checked, close to the 300 study mark, with hundreds of studies visits being scheduled to date. We are extending those approvals in a phased approach. Right now, in our CTRC space, we have approved groups 1 through 3. In all other spaces, we have approved up to group 5, depending on the local leadership at those specific spaces. The only thing that we are holding off on right now is research that is going on in the surgical suites, and we're evaluating those on a case-by-case basis. We use the framework developed by this entire team and the research task force to develop all of these guidances, the portal itself, and to reactivate our processes at Children's. Next slide. I'm not going to go through each one of these, but if you look, this is the entire workflow. There's links embedded in each of these that have all of the details of prioritization submission, when to submit, what will happen when approval is granted, and all of the safety concerns for both our team members and our patients and families. So if you need access to any of these, if you are clicking on the links and you do not have those access, please reach out to me and I will get you access. These are all embedded within our children's SharePoint. My email and contact information will be included at the end of this slide. Next slide. Next slide. So what you'll see here, again, are all of our links for everything you need to know for quick information to activate research at Children's Hospital. Of note, the top link is referencing an epi alert. That link changed overnight. I am going to be getting the slides to Natasha to update those. But if you're clicking on those, you will find all the information you need about best practices or current practices at Children's as a whole. In order to access any of these SharePoint sites, you're going to use your Children's logon credentials. And again, if you have problems with that, please reach out to me and I will make sure that I get you access to all of the SharePoint sites. Biggest information and takeaway from this conversation, especially for anyone that is seeing patients in any of the spaces, is that the information and the guidance for PPE and all the safety questions and guidance are changing sometimes on a daily basis. We are encouraging our coordinators and our research teams to review this information prior to every shift so that they are prepared for the next day, and also so that we're giving the most current guidance to our patients and families. We want them to know that we are just as updated on best practices, so that we are encouraging them to continue to come to their research visits at Children's, and we want to make sure that they know that we are prepared for their visit. Next slide. So two other links, embedded link slides. One is to protect our team members, all the things you need to know, be prepared to screen both yourself and your patients, what masking is required in each of the spaces. And we also have a fantastic social distancing through reactivation webpage that is being supported by both internal and external communication. We have a pretty extensive screening process just to come on site. The other conversations that we've been having are very much to encourage telehealth, to encourage e-consent, and encourage any sort of social distancing or limiting face-to-face participation for as long as possible, as we look to the future to see how we are going to work through COVID, especially anticipating this next wave in the early fall. If there's any questions that you have, any questions that we need to be adding to this guidance, we're happy to do so. We have a fantastic communication support person. Her name is Michelle Middleton, that supports research as a whole. So please get those questions to me and we'll make sure that they're updated. If anything doesn't make sense, we're also happy to have discussions one-on-one. Next slide. So answering questions about on-site visit safety, we are encouraging all of our participants to be given access to this site. It's on Children's Hospital webpage, and it will walk you kind of through step-by-step of all of the safety precautions that have been taken, that are currently being taken, and that have been put in place for our patients, families, staff, and faculty. I'm not going to read through each one of them. They change almost daily, but everyone is doing their best, and we really have seen a lot of work being put into making sure that everyone on site is being safe. Next slide. Team member safety. For those of you who have not yet reported to Children's, which I know that we have had about 80% of our 67 member coordinator team back on site. Anyone who is reporting back to Children's is going to be asked to answer a red cap survey prior to reporting at Children's and to the employee entrance site. The answers to that and the final approval to report to work will be screenshotted, shown to the employee health staff as you walk in the door. If you are going to be working in a patient care area, you'll be receiving a mask. They will teach you how to wear it if you have any questions. Everyone is very thoughtful in answering those questions as you walk in. And any staff in non-clinical areas will be wearing a face covering throughout their workday, including when they are in their administrative workspaces. We have been very conscientious to limit the amount of administrative personnel in the building. And at this time, we anticipate that all unnecessary staff, and we say necessary non-clinical staff seeing patients, is continuing to be working remote until we change kind of how that work is going to be done and how we're going to be using our administrative spaces as effectively as possible. You will find a statement on the use of face coverings linked in the SharePoint below. Again, that changes, but it gives some great guidance for what can and cannot be used for face coverings at Children's Hospital. Next slide. Working in clinical areas, again, this changes consistently. Right now, everything that is occurring in the outpatient pavilion space is considered a clinical area, even the back hallways, any of the landing spots, everything that and that entire side of the hospital, it needs to be thought of as a clinical space. You will be wearing face shields over your masks in any patient rooms. It is expected that those face shields will be clean and disinfected with the hospital approved and provided between patient use. And then those face shields will be assigned to individual staff members for multiple uses. If there's any questions, if anyone needs a face mask, please talk to myself or anyone in that space. There's more contact information provided at the end of the slide deck for people that are overseeing the Children's Hospital research space, but we will make sure we get you the appropriate equipment or find someone who will. Please follow the COVID-19 policy for all donning and doffing and cleaning guidelines related to these spaces. And you can find the link and all updates embedded in the slide below. Next slide, please. For our minimizing our participants' risks, it is so important that we are conscientious and updated to the most recent guidelines. We have not seen a lot of pushback from our patients and their families about attending research visits. If anything, the patients and families have been optimistic and actually reaching out to us to know when they can get back in to see their PIs and their study teams. But regardless, we want to make sure that we're doing the best to keep everyone safe. Our biggest point is that typically, sometimes you have 2 or 3 coordinators engaging in a research study visit. Right now, if one person can be delegated to do all research tasks, we are looking at that as the best practice. Limiting face-to-face contact with our patients and families is the guidance that we're being given by our ambulatory leadership. And so for the foreseeable future, we'll be trying to minimize that contact. When possible, scheduling multiple visits for one coordinator on the same day, so there are as few coordinators in that CTRC and or research space as possible. Our CTRC nurses will be available for rooming, all vital signs, urine pregnancy tests, ECGs, and processing. If there's complicated processing or any other study procedure that is outside of the scope of CTRC nursing, that CTRC nursing is not available, please reach out to one of the members of the leadership team to see how we can make those procedures happen safely and compliantly to make sure that you're not missing any data and or procedures that need to occur during that visit. The more study staff members present equals the less number of visits that we can accept in that space. And we still need to open a couple of more groups. And so we really appreciate people following these guidelines. Gloves and Oxivir wipes, which are provided by Children's, will be at the CTRC workroom and the nurses station. You will need to bring gloves into the exam room for each visit. Next slide. Social distancing and clinical research and the administrative spaces is still occurring. The workroom and nursing station are reserved only for CTRC staff at this time. As I said, the staff will be supporting the processing for simple processing. NICU processing and 9th floor processing can be reserved for all the other complicated processing, or if your budget and or team does not allow you to use CTRC nursing. These specific rooms will be scheduled through research scheduling, the same way you schedule any research visit. And fantastic Jackie Lopez is always able to answer more questions. So please reach out to research scheduling if you have any questions and we need to get you in there to do some more complicated processing. There are 4 drop-in spaces that have been created for our study team. 2 spaces in the alcove between hallways D and E, and 2 spaces in the front workroom behind the glass area. Many of you will remember this is where Flora and Julie Owens used to sit. So that area up there is available. And I would say for now, please directly contact Lisa Lewis if there's any other questions about drop-in spaces or if those spaces are taken. We are really encouraging people to get their visits done and then go back to their administrative space in the admin pavilion or your designated space as assigned. Please use your workstations and exam rooms for clinical documentation. Follow all guidelines, work remotely if possible. We've been encouraging all of our coordinators to come on site only for their prep work, visits, and any other work that needs to be done on site. As soon as that work is done, we're encouraging remote work and probably will be for the foreseeable future. All computers are now going to be printed at the front check-in area. All of our team also has laptops. If there's any questions about printing, access to laptops, or any other IT needs, please reach out to your supervisor and to one of us, and we'll see how we can support you. Next slide. Any questions? I wanted to say thank you and reiterate what Dr. Flagg and Allison had to say. All of these meetings with all of the people involved in this town hall have been so comprehensive, thoughtful, and conscientious. And I'm so impressed that the guiding kind of North Star for everyone was always, how do we do this as safely as possible for our patients and families? So I really appreciate that. The people on this slide are going to be the experts in the specific space that is being used for research at Children's Hospital. So I encourage you to reach out to any of them. And again, all of this information will be housed at the Child Health Research Enterprise Reactivating Clinical Research SharePoint. We're updating that on a daily basis. If you find that anything's missing, we're always open to feedback, and we appreciate everyone's patience. And thanks for all you do, and just so grateful to have your partnership. I'm going to go ahead and hand it over now to Lori Blumberg Romero. Lori is the System Director for Research for UC Health. It's all you, Lori.
Thank you, Erin. Hi, everybody. My name is Laurie Blumberg Romero. I'm the System Director of Research Administration for UC Health. And the first thing I want to let you know is where to find resources about COVID and how UC Health is handling this at this time. So we have a general resources page, COVID page, and then also a sub-page on the Research Administration website. These sites are updated weekly, if not daily, so please review for most up-to-date information. Next slide. Thanks. The general guidance that we have right now is just to minimize visits so that persons that need in-person care can do so. So we also want to minimize the number of personnel in the facility at all times. So same with what Allison and also what Erin said, if you could please work or continue to work with your IRB of record in changing how you recruit or interact with your participants to have as many utilizing virtual visits or phone or Zoom or any type of video needs, that would be most appreciated. Next slide. Our virtual visits, we currently have over 180 projects utilizing UC Health's virtual visits option. So thank you to all of the teams that did all of the regulatory work and working with their IRBs and completing our application to do so. We do encourage all research teams to please complete the REDCap survey to apply to conduct virtual visits for research. This would be for any project with a level 1 through 5 ambulatory outpatient visit with a provider for which they're seeking to perform virtual visits through My Health Connection. We will not be changing any billing indications. So if your Medicare coverage analysis had your visit as being paid through third party or research, your virtual visit will follow suit. Next slide. For the reactivation of projects, we tried to do this very careful so that way it was gradual. So given the slowing of the growth in the number of COVID-19 patients in Colorado and the relative stability of the number of patients being admitted to UC Health facilities, we are reactivating clinical and research activities. This reactivation is subject to the executive orders from the governor of the state of Colorado, CDPHE, and any other governmental orders. So in addition, with the extended reactivation or return to more restrictive functioning will all be dependent on changes in COVID-19 incidences. So I thank everybody who promptly pivoted and moved so well back in March to slowing down their visits, and then now we're ramping them back up. The pace of all the research reactivation at UC Health will be dependent upon the pace of clinical reactivation within UC Health. Next slide. So on May 20th, UC Health provided a new update entitled UC Health Guidelines for Research Involving Human Subjects During the COVID-19 Outbreak. This guidance provides information about operational considerations, staffing, and reactivation requirements. Importantly, all ambulatory clinics will require a surgical mask as PPE for all research teams in our facilities. If you are in a perioperative area or in the OR, you will need an N95 mask, head covering, and shoes that can be wiped down. Other clinical areas will have different requirements, and each of those areas of the hospital, those requirements are posted on the source. When you apply for reactivation of your study and you let us know what areas you're utilizing, we will let you know upon your reactivation approval what you will need for each one of those areas. Please note that UC Health cannot supply PPE to study teams. We do still have a limited supply. So all surgical masks, N95 masks, head covering, etc., must be procured and provided to the research teams from CU. Next slide. So how to apply for reactivation? One, evaluate your activities to see if a virtual visit can be performed. As I said before, we do want to limit persons in the facility to maintain social distancing. Two, send in your request. I do need the IRB number. We need to know what face-to-face research activities and what areas will be utilized. If you could please provide me with the names of the individuals, that would be helpful, with what activities each person will be conducting, and then confirm that you do have the appropriate PPE for that area. We do have different requirements and different processes for the different facilities. So Stedman-Hawkins, Highlands Ranch, Lone Tree, UCHA, we will work that out internally and make sure that that is appropriately reviewed and then come back to you and let you know if there's any additional requirements. We are currently activating or reactivating studies in group 1, 2, and 3 that includes established and new participants. And starting on Monday, 6/22, we will start reviewing groups 4 and 5. Please note that UC Health is still not allowing any vendors into any facility at this time, and that includes study monitors. Once the senior executive group lifts this restriction, we will convey this information to the CRSC and Encore newsletter. Next. And I also want to just note that all CTRC space requests, inpatient or outpatient, goes directly through CU. Janine will talk about that in a moment. That will not be a UC Health review. Effective tomorrow, we will have symptom screening requirements, which means that every individual entering our facility will need to download the app. We have FAQs available, let you know how you can do so for My Health Connection. If you are not utilizing UC Health as your insurance, that is fine. This is a separate section of the application. The screening is in addition to any requirements set forth by CU. So if you are bouncing in between, let's say, RC1 and UC Health, you will have to, at this point in time, complete both requirements for screening. And the temperature self-disclosure, we do understand we're asking people to do it within 30 minutes of entering, and sometimes that time would be people driving. We just ask that you do it within 30 minutes. So even if you do it after you've parked and you're walking in, that is totally acceptable. So I'll look at the Q&A as with all the other moderators and see if there's any additional questions or concerns. You can reach out to, next slide. Oh, you can reach out to me at any time at either my email or our central box, which was on the first slide that I had in this. And we also want to thank everybody for their patience on these steps and everything that has been conducted. We also want to thank the study teams because the proposals that have been submitted have been very thorough and very thoughtfully compromised. So thank you for putting them together in a way that made the review so easy. So thank you for that. And next I will pass this over to Janine Higgins to talk about CTRC.
Thanks, Laurie. Thanks everyone for joining us. I know that this has been a definite process, and I want to thank the CTRC and CCTSI partners, University of Colorado Health and Hospital, Children's Hospital Colorado, and of course Anschutz Medical Campus. We've really worked closely with all these groups. So all CTRC visit approvals, regardless of site, perinatal, UCH inpatient, UCH outpatient, children's inpatient, and children's outpatient do go through the AMC portal. You can't schedule any CTRC visits until your protocol is approved. And one difference between CTRC applications versus campus applications is that we need one application per protocol. We don't accept the big multiple protocol tables. And the reason for this is this lets us review and approve much more quickly. We require all participants to be COVID-19 pre-screened by study staff. We recommend the day before the visit. If they have any COVID-19 symptoms, have had a positive test or close contact with someone who has tested positive within 14 days, you must cancel the visit immediately, and please contact the relevant CTRC where the visit was going to take place so we can remove that research visit from EPIC for you. All inpatient visits, the participants must receive COVID-19 testing. We recommend that they go through the UC Health or Children's drive-through drive-up testing site 24 to 72 hours before the visit. Your study physician will need to order that test ahead of time. Then the patient will be screened upon CTRC arrival also. If they have symptoms, they'll be roomed by our staff and will contact you immediately for taking the correct action. We do ask that you update your study staff contacts right now. We will need to contact you immediately if this happens. Next slide. All CTRC areas are subject to capacity limits. So we are subject to the 50% capacity rule. So we ask that you minimize the number of staff at each visit, because that lets us schedule more visits per day. As Erin noted, you can partner with CTRC Nursing for lots of simple tasks that you might normally have a coordinator come in to do. We do request that if you have non-fasting studies, where possible, please try and schedule after 10 a.m. to provide access to all studies. We understand that some participants will need to come in before 10 a.m., but that would be very helpful if you could do that. We ask that you follow all signage at the CTRC that you're using, all relevant PPE guidelines at the facility you are using. You must clean all areas and touch zones like computer keyboards and door handles before and after seeing the participant. The study is responsible for requiring PPE to their own study staff, which we hope won't be too much of a burden. At Children's, when you check in, if you are Children's staff, you'll be provided a face mask if you will be seeing participants. At the UCH outpatient CTRC, most encounters will just require the face covering that you're required to wear to work anyway. So beyond that, we ask that PIs provide that PPE for the study staff. We want to point out that expansion of CTRC research is really dependent on everybody who uses our space strictly following the guidelines. The guidelines do change often. UCH and Children's just changed their guidelines overnight this week. So please check daily before you come to work. There are times they've changed 2 to 3 times a week. So you really must check before you come to work. And for the UCH outpatient CTRC and inpatient, we require AMC staff to have the correct AMC wristband to enter. So you'll need to check in at an AMC facility before coming to the CTRC. Next slide. So where do you find all this information? It is almost impossible if you're across campus like I am. The CCTSI has created a new web page that links to all the facilities, all the CTRCs across campus. On the left here, you can see the CCTSI web page. The red circle shows a really large banner where all of this information is housed. And on the right, I have a screenshot with the table of projected dates that we're accepting applications, when we hope to start seeing visits for each of these groups. And on these tabs below, you can see there's AMC, so that will link you straight to the AMC page, UCH, CHCO, and perinatal CTRC. Each of those tabs will provide all the information for those specific CTRCs. The contact information, including our COVID officials, are shown on the left-hand side. So if you need any information, you need to check daily about access regulations or what group we're accepting, please go to this web page. Next slide. So I just want to finish. This is my last slide. I know you've all got lots of questions. This is our current projected details of what we will and won't be accepting. We just got news literally as this call started that the UCH inpatient will be opening on June 22 for groups 1, 2, and 3, so that's great news. All of our other sites are open except for perinatal, which will open on June 22 also. And the next groups that we'll be accepting were projections. So for advanced groups past what we're about to see on June 22, we anticipate accepting reviews for those sometime at the beginning of July. That's it for me. Thank you everybody for coming, and I believe we're going to open this up for Q&A.
Thanks, Janine. There have been a lot of great questions that have been coming in as our presenters have been talking. A handful of them have kind of been addressed as the presentations continue throughout this morning. If you do have a question, we ask that you type it into the Q&A that is at the bottom in between participants and the screen share of your screen. And we'll kind of start here at the beginning. First question is, if we are clinicians and we have already returned to campus or never left, do we need to have a wristband? We have heard a variety of responses and interpretation that this could be clarified.
I'm happy to take that one, Natasha. Can you hear me?
Yep, go ahead. Thank you.
This is Tom Flagg. So again, I just want to thank all the presenters. You could just see the amount of work and coordination that's going on here. So I appreciate everybody's efforts in this. You know, it's 3 different institutions, and I think of this in some ways like the badges. We need a badge to get into the different institutions. There were some discussions even today talking about this, so we're going to coordinate it every way we can. But the rule I would use for going through the CU Anschutz screening, if you're going to enter a CU Anschutz building, you should have a wristband on. I don't know if you can see me now. I'm wearing my wristband. So that's you should go through the screening if you're going to be in a CU Anschutz building. Somebody said I'm going from my car to UC Health or Children's. I'm not going through the CU Anschutz building. That's okay. So if you're going right from your car to the hospital buildings, you don't need to have the screening. But if indeed you go in the building, I'd use that as your rule.
Great. Thank you for that. Next question is, for space approval, should that be done as a department or a division within each department? Also, if a coordinator already has been approved and has been invited back to campus, do we still need to submit a space plan?
So the space plans, this is Alison Lakin. The space plans are for areas where there's going to be face-to-face contact with participants. So it's mainly the clinical spaces, or it's where there's going to be core activities, as in RC1, RC2. If you need administrative space, so I know there's lots of questions about AO1, it is still very much on the use the space as essential space to prepare for your research, to do some data entry that has to be done immediately. But the goal is to take what you need from that space and work from home. So there is no immediate plan to be opening AO1 or the Fitzsimmons building. If you need access, then you should be doing it per protocol, so that we can get you onto the critical list. Did that answer the question, or there's more parts to it, I think?
Oh, I think that's great. Kind of in follow-up to that is, once a space is approved, how do we as researchers find out about the requirements for using that space for research visits, i.e. building entrance, patient screening, what kind of PPE we will need to provide to patients, scheduling rooms, handling the transport of biological specimens, etc. It would be helpful to have this information as we are making protocol modifications.
Okay. So as you heard, space plans are still in the process of being approved. Just from what you heard between the 2 affiliate hospitals and the CTRC, each space has some unique challenges. And so I can't, unlike the hospital, I can't give you one size fits all. So that's again why the COVID officials become critically important. Janine can talk about how they're going to continue to communicate expectations with the CTRC, but for all the other spaces, you do need to work with the COVID official in that space to know the expectations of that space. But it's all predicated on the same general principles that you have to wear a mask, you have to be screened to get into the buildings. Participants need to be screened the night before and then screened again in the morning. Who's actually doing the cleaning, whether that's you as a coordinator once that visit's finished, or whether somebody in that building is going to do that. Again, that's what you have to work out with the COVID official. PPE is a challenge. So as you heard, even for the CTRC, each research team is expected to have their own PPE. So there is a PPE committee. The COVID officials for the spaces can help to coordinate purchase of that, or go through the department to the School of Medicine, and they can facilitate purchase. One of the things that we've identified is that even if in CU Marketplace it looks like you can buy PPE, then those orders are not being fulfilled. So there is a PPE committee that is purchasing in bulk and then coordinating to ensure that the research teams have the PPE that they need. COVID officials, as I say, tend to be for the space, but if you've got questions, you can always reach out and I can direct you.
Great, thank you, Allison. I think this one more quick question that seems to be popping up as well. If we need access to our offices just to pick up supplies, do we need special permission, or can we just do the appropriate screening and enter?
No, you still need to go. I'm sorry to make this more bureaucratic than people want, but if you have approval to do the vast majority of the research either at UC Health or at Children's, but you need access to CU and shoot space, even if it's just momentarily, you should be indicating that on the application in the REDCap protocol review process application, so that we can get you onto the critical list, so that because I will tell you that there is central monitoring of badge access, so we know who's in the building, and you have to have approval to be in the building. So if you're not already on a critical list, now if you were on a critical list before the ramp up, that still holds. But if you need access per protocol, then that should be through the approval process, the Anschutz approval process.
Great, thank you. Next question is a lot of questions about wristbands and checkpoints. Here's one. When will an AMC point of contact be available for the centralized ordering of PPE cleaning items so we can order the supplies we need to do research visits? And then they reference a link that has some information about it, but that seems a little unclear to a few individuals.
Okay. There is a request form for PPE that is, as I say, being managed by the PPE committee. If you're not sure how to access it, then contact the division if you're not going through a particular space. The COVID officials all have all the information, but there is a form. If you need me to send it to you, I am happy to send it, and then it's coordinated with the PPE committee that is being led, I think, by the School of Medicine. Dr. Flagg might be able to talk a little more to that.
Yeah, I'm happy to comment. So it's kind of a campus-wide a group that it was determined, I'd say maybe a month ago, a few labs were getting orders to go through and a few research groups were getting orders to go through, but most were being denied just because they were small orders. So we thought that if we took kind of a campus level approach to ordering these and scaled up, and I think it's actually maybe being organized across the system now, we'd have much better purchasing power, not even so much for price, so that's part of it, but just to actually have a recognized order. So there's a committee that's organized to essentially coordinate these individual orders. There's a form associated with that, and we think we will and are having better luck in fulfilling these orders. COVID officials are aware of it, but again, just email us if you don't have either a department divisional person that can help you with that or a COVID official, we can help you.
Great. Dr. Flagg, I think this is another good question that probably is for you. Do you anticipate that if there's another surge, we will again halt non-critical research and then follow the same plan and reapply again? Or will research that has already been classified by group, example 2D, just be reopened in waves when the university deems it safe without going through another round of reapplying?
Yeah, so thanks for that question. Let me say a couple of things for this. We had to abruptly shut things down. It was difficult, I think, on many of us. Our goal, and this is from the campus leadership on down, is to not have to do that again. We'll do everything in our power to maintain campus activity as long as we feel it's safe and within state and other guidances. Some of this may be out of our control. Again, some of the groups that do modeling are predicting another peak in the late summer or early fall based on all the data and the modeling that they have. If indeed that is the case, and if indeed we think for safety reasons we would have to restrict some activities, or frankly maybe ordered at a state level, one of the things we've learned now is we have these health check-in points. We have a scale that I think each of the different groups have said. We may have to scale things back. In clinical research, it'll be a conversation with the hospital partners as well. And I think the fact we're using similar metrics or scales will help so forth. So I think we'll do everything we can to avoid that as long as we can do it safely. I think there is a possibility that we will have to respond and essentially adapt to the situation, whatever that may be.
Thank you.
Yes.
I think this is for Children's. For staff that work at Children's but have to go to an office in a university building to print something out or get supplies, do they need to screen at both Children's and university, even if they will only be at the university building for a short period of time? I think, Allison, I think you kind of addressed that as well.
Yeah, if they're not, this is Erin, if they're not coming into Children's, they don't need to screen at Children's for that day.
Thank you, Erin.
Thank you.
Yeah, and they do, I mean, basically, you need to screen at whichever institution you're accessing the facilities. So even if it's only briefly, we do need to know, because people are checking those lists. They know from your badge access where people have been, and there will be follow-up. So please, I know it seems over zealous, but there are reasons that we have to be able to document who's gone into the building and for what purpose, so that we can be watching the capacity of the buildings.
Great, thank you. Here's a little bit of clarification would be helpful. If we're supposed to do people are unclear if we're supposed to do the red cap form or an email to UCH administration to apply for their study, or to be invited back.
Hi, Natasha.
So as we kind of went through, it depends on what you're doing. So you have to follow UC Health's process if you need access to UC Health. If you need any access to at CU Anschutz, then you do have to go through the red cap form to get access, even if it is just to get binders or to get investigational product or to do data entry. If it's, we're doing that on a per protocol basis because we are not fully opening the AO1 buildings or the Fitzsimmons buildings.
Great, thank you.
Lori,
And this is Laurie. Yeah, I just want to say, when teams get their open to accrual and Epic activation email from Encore support, that is the notification that your project has been approved through the normal channels that we've had in existence forever. You still need to apply through the red cap for AMC, Children's, and UC Health in addition to that if you want to conduct your study at the time.
Thanks, Lori. There's a question, is there any information available on a VA research ramp up?
The information I've seen has come from Central VA, and I would be contacting the VA research office, as the VA has their own specific requirements.
Thank you. Here's another question. There's some concern and confusion about what is considered aerosol generating procedures, AGPs. Are there strict definitions about which procedures are considered AGPs? My question in particular is related to testing with metabolic carts. We are planning to use N95 masks, but have learned other institutions are requiring fitted N95 masks for these procedures. If we desire to provide fitted N95 masks to our staff to provide extra protection. How would we go about that?
I'm going to assume that that is exercise testing that is happening on the Anschutz side. Otherwise, I would say you follow the hospital policy. We are still working through, and that's why currently there is no space on this Anschutz side that is approved for exercise testing, because we're still working through what that protocol is with various levels of leadership. So stay posted for that one.
This is Laurie. I just want to say for UC Health, if you are having any AGPs, we do have enhanced precautions. The sign will be on the door of the patient's room, and then you also would have to follow any enhanced droplet or airborne precautions that are posted on the source.
So another question. Are there recommendations on where teams can purchase surgical face masks?
I'm happy to comment on that one. I think an interesting thing has been some groups would say we would like to get surgical masks for general use. And I would say in many cases, they could just use cloth coverings. If someone has a specific need for a surgical mask because of a guidance or some need, they could work through the PPE committee. But most of those requests that I've looked at and kind of worked through, they actually just could use cloth coverings for that particular instance. But again, if surgical is needed and so forth, you could go through that PPE committee.
Thank you. Here's a good question. Some questions about the CTRC PA plans to come to our clinic in one of the barracks to do a minor procedure for a research study. Do I have to go through the portal for this in addition to research reactivation plan that's already submitted to CU?
Each protocol needs a reactivation approval for the protocol.
This is a good question. Do research participants need a wristband?
No. So that within the space plan and within the protocol ramp-up approval process, you should be identifying how you're going to be screening participants, preferably at least the night before, and then what the process is going to be when they come on campus and what the follow-up screening is going to be. So that's part of your space plan, and then wherever you're seeing those participants, you have to follow their space plan.
Thank you. When does CU Anschutz expect to start approving Group 3 protocols?
We generally are trying to get the spaces open, and we're using the Group 1 and Group 2 to beta test that ramp up. And as soon as the spaces are comfortable that their processes that they'd anticipated in the space plans are working, then we'll be moving to Group 3. So I would, get very close on some of the space plans, but there are some significant sites that are still need to get approved. So I would think we're talking the next, it's always challenging to give timelines. I'm going to guess the next week or two.
Thank you. Do research operations, specifically DEXA scans at the adult CTRC in the Loprino building, need to be approved through UCH? We submitted a REDCap survey to both Children's and AMC, and I just wanted to know if we need to submit something additional in order to be approved for these scans.
No, if the only UCH space that is being used is CTRC, you do not need to also apply through the UCH process.
Thank you. If a protocol requires both children's CTRC visits and home visits, how do we proceed?
So you would go ahead and submit that right now through the reactivation portal. The branching logic would end up getting it to us. We have not had conversations specifically about home visits, but go ahead and submit it via the portal, and we'll reach out to whomever's protocol it's under.
Thank you.
Well,
So that part of that will, so then you're kind of getting to the community-based research projects, and as I say, there will be an approval process for those. It will not be the same REDCap survey that we're using for the current ramp up, because there are extra considerations when you're going into the community. So I would stay posted. If it's CU employees that will be going into home visits, there'll be more information to come in the next couple of weeks.
so Alison, should those types of studies wait to apply until they can do the community visit, or should the CTRC approve those for the children's part and then they wait for the community part later?
I think, I mean, again, this is back to the PIs looking at the integrity of the study. If you can't do all the data collection that you need, then I would be encouraging people to wait. If the home visit is an optional component and they can get data collection that they need to answer the research question, then they can go ahead. But just be aware that the home visit is not going to be available for another couple of weeks.
Thank you. For biobanking studies that utilize UCH clinical spaces, will we need to submit the reactivation approval and the form stack approval?
You will need to submit the protocol reactivation REDCap form. You don't need to submit a space form, because the space, if you're using lab space that's already open, it's been approved and that space plan is in place. What is important is that you work with those labs where those samples are going, because you can act as a courier, but the chances are high that somebody will have to come down and meet you because you won't have access into the building. So you do need to work with those cores to establish what that transport process is going to look like. It may be adapted to this new environment. It may not be what you're used to.
Thank you. Are there space plan templates available?
You can, so there's the reconstitution plan has in it the cleaning, the expectations of that space. So you can use that. And then the form stack form itself walks you through the key components. Most of the time, it's really helpful to have a copy of the space plan that's marked with the traffic flow that you're anticipating with participants, and which rooms you're actually using and how many people you're anticipating will be in each of those rooms, so that we can get a good sense of the plan. But the form stack is a good starting place, and the reconstitution plan.
Thank you.
Hard to come up with a template because each space is very different. And it's also interesting, yeah, just where some of the clinical research is. We've got a couple of people who we're trying to limit participant access into RC1 and RC2. So for those groups, again, if you've got challenges with how you normally do your research that you think are going to get delayed, please reach out to me and let's talk about options. So for a couple of people, it's going to be quicker to ramp them up on the CTRC than it is in the space that they normally use, for example.
What priority is a community-based project with healthy participants without face-to-face contact, telephone and Zoom contact, REDCap questionnaire completion, for example, but for which biospecimen are self-collected and are returned via UPS to be approved laboratory in RC2?
So if the specimens are being mailed and somebody from that lab is collecting the specimens and processing them, then they just need the right IOs because they're not actually accessing any space. But if a coordinator, if these samples are, like, for example, being delivered to a space on campus and the coordinator is opening the mail and then transporting them to the lab, that will need to go through the protocol approval process so that we can get the right staff access to the necessary buildings.
Thank you. This just came in. Still not clear to me. We've sent in the space plan and a research reactivation plan for our study using CTRC PA in our clinic in a barracks building. Do I also need to submit something through the HSR portal because of the CTRC personnel involvement?
Well, if you are now changing your protocol, so if you were previously doing work on the CTRC and you're now going to be doing it in one of the 400 buildings, that needs IRB approval. So you would need to submit an amendment to say that you're changing where you're doing that research. But if you've gone through the space approval and you've gone through the protocol ramp up, and you've coordinated with the CTRC mobile nurse, then and you've got IRB approval, then you're good to go.
What advice for a study which has not yet started enrollment before COVID shut down regarding applying for priority approval would be offered?
I think given the uncertainty, as Dr. Flagg mentioned, there is a prediction that we're going to see another spike at some point. I think it's important to really just look at your research study and optimize it to minimize face-to-face with the idea that if things do need to go back to being done as remotely as we can do it, then you're not impacting the data integrity of the study. So I really do think we're in a new world and that some of these options of e-consent, telephone, telehealth, Zoom, to do some of the procedures or data collection that we would like to normally do face-to-face, it's going to be better to be continuing to start them remotely, because that way you can have quality data all the way through. But you've got to measure that with the integrity of the science that you're doing. So that again is why a lot of this does fall on the research, the PI and the research team to ensure that they're able to answer their research question with quality data.
Thank you. We've got about 10 minutes left here, so we want to be cognizant of time. Just as a reminder, today's town hall is being recorded and will be saved in addition to the slides on the Clinical Research Ramp Up webpage. So that will be available to everyone. If you have a lot of questions were sent in the Q&A chat earlier, so they've been addressed, but if you feel like something has not been addressed and is urgent, if you could please put that in one more time, that would be appreciated. Here's one. I think this is kind of a general question. It seems that all the institutions are accepting different levels of groups for reactivation right now. If we have been approved at UCH for research visits under group 3, but our coordinators need access to CU building to gather supplies, do we need to wait until group 3 opens at UC before reactivating the study?
So this is where it gets tricky. Now, I mean, it depends on what space you need. So if it's literally just for supplies, then no. You can submit through the Red Cap and just be clear in the request as to exactly what you need on campus. That's where we'll work with you if we're not sure. But yes, and we're understanding that different facilities have different capacity, and we're trying to facilitate as much as we can, but there may be some challenges depending on the space that you're looking to use. And I saw there's, just to reiterate, there are no COVID officials currently for AO1 space. It is AO1 in general is essential access only. So if you have binders, if you need access to your offices, that is on a protocol by protocol basis, but the goal is not to have people in that building for any extended periods of time.
Thank you.
Can I add one thing? This is Janine. There's several questions about the inpatient COVID-19 testing. Laurie, people want to know how this will be billed. There's multiple questions.
Yep, I'm putting that together right now, and I will post that in a second with the FAQs so that everybody has all the resources. I did also see that. Sorry, okay. I'm typing as fast as I can.
Me too.
Yeah, there were lots of questions about PPE. Here's one. We are working on starting a study where only the patient interaction is a home visit by a home health nursing company we contract with. Will this have to go through the community-based approval?
Yes. If we are contracting on behalf for somebody else to do work on our behalf, but it's for research and it's being conducted in the community, then we have a level of responsibility for that research, and we will want it to go through the community approval process.
Great. There was also another question that was made in reference to the URL for this clinical research ramp up page. We are working with OIT to get a short URL. So right now, there's a variety of different ways where you can find it because the URL is rather long and lengthy. But if you go to Google and type in clinical research ramp up at CU Anschutz, it takes you directly, the first pop-up takes you to that URL. OIT's been working on some other issues, so it's just taken a little bit longer to get that short URL, so we apologize. But again, all of these slides will be saved and available. Also, we can send it probably out in the weekly update and post it on the research guidance webpage with coronavirus information there as well. I think there are a few more questions.
And I would just like to reiterate as well that as we ramp up, it really is where everybody wants to ramp up as much research as we can within the limits that we have from CDPHE and from the governor. As Janine mentioned, the more we limit the number of staff so that we can actually have the more subjects we can have on campus. But just because the space is approved and the protocols are approved, there may just be some feasibility logistical challenges with actually scheduling all the participants given these limitations. So it is really important to be coordinating with whatever spaces you need to make sure that you can schedule. And I say we're all working closely together to try and make this as seamless as we can, but it is, you know, these are challenges. It's challenging times.
Okay, we have just a few minutes left before we're up on the hour. We want to be cognizant of people's time. Do we want to share the summary video, or should we just see if there's one or two more questions to ask?
I'm going to do one or two more questions.
Okay. Here's a good one. Now that UCH requires temperature checks, how does our department go about purchasing a thermometer, or will UCH provide this?
Yeah, UC Health is not providing thermometers. They're not providing them to their employees either. We have all been told that they are available at Walgreens and Rite Aid and Walmart, and we can purchase one and take our own temperature for the screening to put into the system.
I'll make one additional comment to that. Some people have had difficulty finding it. Maybe it's better now than it was a couple of weeks ago. I would just suggest too, people have difficulty. You could go through the CU Institute screening where it's checked. It'll tell you your temperature if you ask them, and then you could use that. That's what I'm going to do. I'll just go through both that time and get your temperature that way.
That would be totally legitimate. Thanks, Dr. Flagg. So if CU checks your temperature, that counts to put into the UC Health system.
Thank you. Yes. And Natasha, I'd be happy to say a couple words at the end whenever you get to that point.
Okay, that sounds great. Once we order cleaning supplies and PPE from the website, how do we get them? I'm assuming there might be a lag maybe with personnel and that arriving.
I don't have all the details. I'm assuming that once the order comes in, that somebody from that committee will reach out. There'll be some speed type changes of information is my guess, and they'll coordinate with you, but I don't have all of those details.
If I understood the question correct, it might be like a kind of, let's say, a flow situation where if they have some on hand, they ordered for you and there's a delay, they could perhaps use some that they have on hand waiting for your order to come in and replace it, something along those lines. But I would just encourage people to reach out to the committee, and I think we're very pleased to have that committee set up. So Natasha, I'd be happy to make a couple quick comments here at the end and then allow Allison and everybody else to make additional things. It's a tremendous effort, as everybody's seen, to do this. Again, I just want to acknowledge all the leadership from Allison and Lori and Janine and Aaron and everybody else involved in this. Clinical research is complicated already. It cuts through the regulations of research and the regulations of clinical care in many cases. I would just emphasize that we will likely have to make changes over time. I hope not, but I think likely. We've got a great game plan, basically a scale we can go up and down as needed. We're going to do everything we can to open research across all realms as quickly as possible. and to maintain research in those areas as long as we can in a safe manner, and hopefully through whatever's ahead. So with that, again, I'd just like to invite Allison or everybody else to make closing comments that they may have. And I particularly appreciate all the efforts of Allison Lake, and who's been leading much of this.
Thank you, Dr. Clark. I mean, I think I'd just like to thank everybody again for their patience. I know this impacts everybody's research, and it is challenging and it's hard when we don't know exactly the future, but we've really worked hard to collaborate across the affiliates and CU and shoot so that we're all on the same page. And it may seem a little laborious, but the reason for all the documentation is so that if we have to change midstream where we think we can go, we will be in a very different position to do it moving forward than we were initially, so that we can do this in a much more thoughtful and communicate directly with the various partners to make sure that we can kind of keep patient safety priority, keep staff safety priority, but also minimize the impact to research. So it's a huge team effort.
Allison, this is Erin. I think the one thing I also agree with everyone's thanks and kudos for all the wonderful work. The one thing that continues to be brought up are the e-consent ability, and I just want everyone to know that that's an active priority, probably one of the most important priorities that we're getting worked on right now. I know Allison and Lori are looking at those possibilities, and we are at Children's also, so please stay tuned, and we anticipate that to be able to come online fully for all studies within the next couple of months. So any questions that we can field about that, please reach out to any of us so that we can support your remote work.
And that is available, that resource is available if you are not doing FDA regulated research. The REDCap has the ability to do e-consent, but we are in the process of ramping that, just putting the paperwork around it really to make that Part 11 compliant from an FDA standpoint. And as Erin mentioned, and I know it's true at UC Health too, they are working on an e-consent process within Epic too. So those, given that we know that this is going to continue to be a challenge, we're trying to build as much supporting infrastructure as we can to facilitate research moving forward. Lori, do you want to close out? Any last comment?
No, I just want to echo what everyone else said. I mean, it's been really great partnering with everyone and getting this up and running. I mean, parts of it are stressful or problematic, but I think everybody has really chipped in together, sorry to be so hokey, on getting this up and running. So I just want to thank everyone who just has been so thoughtful and understanding with how many things behind the scenes have been coordinated and put together. And I'm just really grateful to be partnering with Children's and CU and CTRC on this, so thanks.
I think with that we'll close, and I just please don't hesitate to reach out to any of us if you have ongoing questions, or if as things change you're not sure, please. I'd much rather you ask and to make sure, because if you're asking the question, it is likely that you're not alone. So it's really helpful to hear what's working, what's not working, and where the questions still remain. So thank you. Thank you for taking the time.
Thanks, Allison, for putting it together.
And again, as a reminder, the slides and a recording will be available online, and we will send that out. Also have that posting on the research guidance page as well. Thank you all. Have a great day. Thank you.